Hello everyone and welcome to the Optic Guide. Today we are going to talk about a very important topic in eye movement, the nine position of gazes. This is super helpful for understanding ocular motility, cranial nerve palsies, and orthoptic assessment. Our eyes are able to move in different directions thanks to six extraocular muscles. These extraocular muscles are superior rectus, inferior rectus, superior oblique, lateral rectus, and medial rectus. These nine position of gazes involves all this. Ignore this. This might look like the goat eye, but I can't do anything. This is the primary position when a person is looking straight ahead. This is the elevation, up gaze, down gaze, right gaze, and right up gaze, right down gaze, left up gaze, left gaze, and left down gaze. All of these gazes helps to assess different conditions. This is the primary position. In the primary position, person is looking straight ahead and none of the muscle is in action. But when we talk about the elevation and depression, remember this, that in the case of elevation and depression, only in these two cases, two extraocular muscles of each eye is in action. You can see in the case of other variants, only one extraocular muscles of one eye is in action. But in the case of elevation and depression, it's different. Two muscles of each eye is in action. Simple elevation or depression, remember, not in dextro elevation or in levo elevation. As in the case of elevation, right superior rectus and right inferior oblique is in action. Right eye inferior oblique will be in action. The inferior oblique will help to elevate the eye. Left eye superior rectus and left eye inferior oblique will be in action. Okay, now when we talk about the depression, in the case of depression, right eye inferior rectus plus right eye superior oblique will help to move eye in the down gaze. Left eye inferior rectus and left eye superior oblique will help to move eye in down gaze in depression. In order to memorize it, that in the case of elevation and depression, the obliques will help the rectus. But if it's superior rectus, then the helping oblique will be inferior oblique. And if it's the inferior rectus, the helping oblique will be superior oblique. When we talk about the dextrovariant, it's very simple. Right eye lateral rectus and left eye medial rectus will be in action to move the eyes in the right gaze. When we talk about the dextro elevation, right eye superior rectus and the left eye inferior oblique will be in action. Remember this also, that in the case of dextro elevations and dextro depression, levo elevation and levo depression, the in which direction the eyes move, like if the eye is moved in the right direction, then there will be the rectus in action of that eye, and of the other eye other than the gaze. If it's right gaze, then the left eye's oblique will be in action. The right eye's rectus will be in action and the left eye's oblique will be in action. Same as in the dextro depression, right eye inferior rectus and left eye superior oblique is in action. If it's the elevation, then the other eyes inferior oblique will be in action, and if it's the depression, then the other eyes superior oblique will be in action. Now when we talk about the levo vision, in levo vision or in the levo elevation depression, in the case of levo vision, it's also simple. Left eye lateral rectus and right eye medial rectus is in action, and in the case of levo elevation, left eye superior rectus and right eye inferior oblique is in action. In the case of levo depression, the left down gaze, left eye inferior rectus is in action and the right eye inferior oblique is in action. As I have told you, this may clear it in a very fine way, that in the case of the levo version, it's same as I told you in the case of the dextro version, that the eyes, if it's the left gaze, then that left eye's rectus will be in action. On the other hand, the other right eye oblique will be in action. As we know, the oblique that moves eye downward is inferior oblique. So in the case of liver depression, it will be the inferior oblique. Hope so this will clear up your all concepts and will help you to memorize it for a long duration of time, because it helped me a lot to memorize it, these tips especially. So yeah, that's all for this video. Don't forget to subscribe for more eye related videos, and if you have any questions, comment down below. Thanks for watching.